I think it's the comprehensive approach. So sometimes we'll have the tendency as physicians to be a little bit more blinders on, directed to goal solving and really stick to algorithmic care at times. And it's because it's simple and reproducible. And sometimes we need a little bit out of the box thinking too. And that doesn't necessarily mean we're going completely crazy. We're following good standards of care. We're doing so thinking outside of just our strict algorithms. That's the things that I get with you. When we're talking, we're seeing our patients together. And I say that truthfully, we're seeing our patients together. You're able to offer them that extra bit of thoughtfulness that maybe I don't even have time to offer them, let alone some of the expertise. When you look at the benefit of what the program we've developed, and I say we developed together just because I'm lucky enough to have been met with you guys and actually with the Stanley folks and actually get an opportunity to build this and kind of give feedback. So when I say that we've developed this protocol, I really have pride and ownership to some degree because I have that relationship with Stanley. When I look at what that does for us, it allows us to streamline our care because, as you know, we're all being pushed to see as many patients as we can, provide us the most comprehensive care as we can in even shorter periods of time, which is very difficult. So by having these protocols, by working together, having you at Stanley being able to provide patients more counseling than I can do and getting that touch points with them, it's reducing phone calls. It's actually improving patient adherence because they're hearing it twice. They're getting the introduction from me and then they're getting the kind of knock it out of the park from the Stanley pharmacist saying, okay, this is what we're gonna do to get this thing treated. By having that, the compliance is improved. The rate of returns of patients are improved because, again, they're kind of impressed. They're saying, look, I have both a physician and a pharmacist working with me. And that's really been a value add for our practice as well. Stanley has, again, something else very unique, I think, which is that these notes I get back from the pharmacists that go through and kind of talk about the clinical, what the expectations are, lay out the kind of pharmaceuticals direction we're going to be moving in, and gives me clarity about what's being offered by the patients. That's something that I, again, don't get from obviously the big box pharmacies, but more importantly, I've never gotten that from any other pharmacy, compounding pharmacy that I've worked with. That's extremely unique. I can take that information, I can put it in my chart, I can look at it later, we can resource and reference that. And then I can understand what has and hasn't been done a lot more clearly, right? So in some patients that do require more advanced therapies for their incontinence or their erectile dysfunction, I'm able to then say, okay, this is what I've seen in the past. This is what you worked with. We've checked off boxes that may or may not have been checked off in the past when we weren't working with these guys, right? Now we've done everything and here's our next steps. So having that is a unique thing. And again, another value add. So one of the, again, like special things that I have with Stanley Pharmacy and what I've been so grateful for with this partnership is that it's not about me sacrificing my patients up. I'm not giving up my patients to someone else and saying, please take care of them. What I'm doing is saying, please help me take care of my patients. That's huge because sometimes the burden is difficult to bear for just one physician to deal with some of the complexities that come with sexual restoration problems, right? There's patients that have emotional burdens. They've gone through all the different medications. They maybe had a lot of questions that I can't answer specifically. So having a partner in that is so key and so valuable. It makes my job easier. And when my job's easier, guess what? I have more patients to see, more patients to refer. And on the back end of things, when we're partnering the way we are and we're building a plan for a patient, I benefit on that back end. Sometimes the patients need to come back for the more advanced therapies like we talked about. So I kind of win on both ends. One of the things I got to tell you that I'm very fortunate with, and this is true, is first of all, Greg and I at Stanley, we're friends. I think we text each other, we send each other jokes and all the rest, but I know that I'm fortunate that I can text him and say, hey, Greg, listen, I got a patient I need you to speak with. I'm having some troubles. And he can kind of counsel me on some of the things he recommends and says, you know what, I'll reach out to that patient. That's so huge to me because it really means that he has a passionate edge to him. It's not just about dollars and cents. It's about providing awesome care to my patients. Super unique. Love it.